live well with Health Plan of Nevada's Medicaid plan. Get 24/7 virtual visits and health education and wellness classes in person and online. Healthy has its rewards. Visit myhpnmedicaid.com to find out more.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, here in Beverly Hills, I am with my co-host, Dr. Millicent Ravello. Millicent, what's going on?
Not a whole lot. Just finishing up seeing a whole bunch of patients and hanging out with you, doing the podcast.
Well, it's a good way to finish up the day. It is the holiday time. I've got a lot of rhinoplasties to do, but that's not what we're talking about today.
Not today. Today we are talking about liposuction.
Liposuction is a great holiday topic.
It's very appropriate, right? When you think of all the eating that we do and all the anxiety that goes into the eating and the weight gain, it's a good one.
What if you need liposuction before the holiday season? Should you get it done early and then pack it back on? Or is it one where you just go you know what, I'm too far gone. I'm going to add, insult to injury and I'll get it handled after the holidays?
That's probably a more realistic and better way of doing things, unless you know yourself and you know that you're really good at being strict about your eating habits and you're not tempted by all those ridiculous sweets and yummy things. If that's you, and that's 5% of people, then yeah, go ahead and have liposuction before and starve yourself during the holidays to maintain your goals.
No chance.
But otherwise, you might want to wait until after.
I'm sucking it out after. So here's the deal. There's a lot of ways to get liposuction. Liposuction is a very broad topic. We are going to have probably, conservatively speaking, 12 podcasts over the next 3 years about different aspects of liposuction.
Easily.
Right? Yes. So today we're going to paint with a very broad stroke what this operation is, who's a candidate, and what types of liposuction there are in very broad strokes.
Yes, we'll do that. We'll go into a little bit of detail about what it entails, and we'll kind of, break down what all the terminology is, because there's a lot of, uses and various descriptions and labels for liposuction. So we'll clarify.
I'd like to add it's an operation that is high on my list of Christmas gifts that I'm willing to accept. So if somebody's, I don't know anybody who can do that for me, but if there's a gift in the making here, I just want to know that you've got that on the list.
Is that a GoFundMe?
I'm just saying, whatever I got to do.
Calvert's liposuction.
Yes, as a matter of fact, it is. So liposuction, the way that I was taught liposuction, and the way that I think about it now, is that liposuction is not about what you take out, but it's about what you leave behind. Because what you leave behind is the result.
That's what you see.
It's like a sculptor. He starts with a block of stone and takes stuff away. And what is left is the sculpture.
Right. And so that's exactly right. The overall result is what's left behind. And there's a variety of different ways you can get to that end result. And that's sort of what we'll talk about.
Sorry, I just need a little San Pellegrino. I know you're looking at me like, what are you doing, dude?
That's your cue. You speak next.
No, I'm not speaking. There's no cue here. I really need some Pellegrino. That's all I'm saying.
Okay, have at it.
We're plastic surgeons, for God's sake, all right?
While you're having your San Pellegrino, let's just go into a little bit of basics about who is a candidate for liposuction. Why would you have it? Is it for you?
Well, I think one of the big things is that people don't understand is that liposuction is not a weight loss procedure.
No, not at all.
In fact, you should probably be pretty well weight stable.
Right. You should be at your goal weight. So if you're on a diet and exercise program or you're planning on losing, a certain amount of weight, you really need to be pretty close to that goal and stable there. You don't want to be right at your goal and then, going to the plastic surgeon. You got to be stable there. Make sure you've really, stabilized at your weight. And then if you still just have these stubborn areas of fat that are not going away, no matter how much you diet or how much you exercise, or if you're losing weight all over, but you just have those little rolls in a certain part of your body that aren't going away, that's when you're ready.
Rolls are never good. Nobody likes rolls.
Rolls should never be what you have on your body.
No, Rolls Royce, okay,
yeah,
fine.
That's better.
But rolls on your body, no. So that's how I think about it. If there are areas that you can really see that they're sort of standouts on your body contour. Like, I don't like these saddlebags.
Right.
I don't like these love handles.
Right.
I don't like this gynecomastia. I don't like this belly roll, those things that you can look at and say, yes, they're doable. Somebody who's just plain bigger than they want to be, it's not really that effective because you're just going to make them a smaller version of out of shape.
Although there is one caveat I will say to that. And, sometimes we refer to this as total body liposuction when you do large amounts of liposuction on various parts of the body, arms, abdomen, legs. And I have had a patient or two who came in not at their goal weight, who wanted total body liposuction. And even though we had this whole conversation, this isn't a weight loss procedure, they said, I really, really want to do it. And I understand that. And you know what? It did kickstart a weight loss regimen for them.
Yes.
Because they were struggling to get the motivation they needed to really put an effort into it. And this, once they kind of saw how good they looked at a smaller size, was really the motivation that they needed.
Yeah, I mean, that's definitely a way to do it. But in general, I find that the people that are happiest with their liposuction can point to the areas.
For sure.
You can definitely deal with them.
Yeah. And they're generally average, normal weight or at their healthy weight. And they say, I just don't like this.
Right. And that's where I really feel like you can get amazing results, weight stable, have the time to heal these. They don't heal overnight. People think they're going to get liposuction and walk out to the party.
No, it doesn't work like that.
You have to heal it up.
Yeah.
There's a healing period of 2 to 3 weeks of being sort of like, okay, is this what I signed up for? Because it's swollen where you took away the fat.
Right.
And that has to go down. And the skin contraction really doesn't start till about 2 to 3 months after surgery.
Right. So I tell my patients, you're going to be swollen for a couple weeks, depending on how much we do and where we do it. At least 3 weeks, you're going to be swollen. You're going to start seeing your final results and your swelling coming down after 3 weeks, up to 6 weeks. But really, I say 3 months before you really see your final shape.
And of course, the skin contracture is variable.
Yes.
It depends who is having the liposuction, whether you're going to get really nice skin contracture. Again, if you're 20, very different story than if you're 65.
And the skin contracture is when, you've lost volume, you've lost fat, and your skin shrinks to accommodate your newer, smaller size. And like you said, if you're 20 and you're young and you're healthy, you have a lot of elasticity in your skin. So when you lose weight rapidly, no problem. Your skin just
That's right.
Snaps right back. However, if you're older and you just don't have as much elasticity in your skin, or if your skin has been stretched out from pregnancy or from a lot of up and down weight loss kind of issues, then you also don't have good elasticity to your skin, especially in your stomach if you've had lots of kids. So sometimes in those cases, once all that fat is gone, the skin doesn't snap back. And so now you have loose extra skin.
I noticed that after we had our fourth kid that my skin didn't snap back as well.
Your skin.
Yeah, it's just
that sympathy weight gain.
My baby weight never came off, so I'm just gonna have to deal with it. It's true. I mean, the daddies do gain weight with pregnancy. It's at least this daddy did. I don't know if all of them do. But
that's the GoFundMe, Dr. Calvert liposuction.
I'm in the market for this. It's very straightforward. So let's talk about the types of lipo. There's traditional cannula based, and the way what liposuction works is we actually pump fluid into the areas that we're going to suction first. Mm-hmm. Patient is either asleep, awake, under sedation, whatever you want. There's a lot of ways to do it. And then you pump fluid called tumescent fluid into the area to tumesce it, to get it swollen. And that tumescent fluid will help do a couple things. It'll be hemostatic. It'll help get the fat ready to kind of come out. And it allows for a safer, less blood loss liposuction.
Right. Because, there's different ways you can prepare it, but generally speaking, a tumescent solution has lidocaine in it, which is a painkiller, so it numbs the area, which is very nice for the patients. And then it also has an agent which decreases blood flow, so that when you are doing the actual liposuction, there's less bleeding.
And I think, that technique really changed liposuction, the tumescent technique. And then you can use cannula-based, where you use basically a metal rod with holes in it attached to a vacuum, a suction machine, and you suction out the fat. Mm-hmm. And there's a lot of different technical ways to do that. You can use power-assisted liposuction, which has a vibratory component to it that literally shakes the cannula and breaks up the fat mechanically while suctioning it out. There's Vaser liposuction, which I haven't used in a very long time, which is ultrasonic cavitation of the fat, which uses an ultrasound to bring the fat into the cannula. And then there's laser-assisted liposuction, which is one of my favorites. I should mention that I am a luminary for all my lasers, so I want to definitely have disclosure about the laser liposuction because they hire me for consulting and things like that. So important to disclose that. But at the same time, the reason I became a luminary for them is I loved their products, and then they kind of said, "Oh, you should really speak about it. You're pretty good at that."
Right. So all of these different devices have kind of a similar goal, breaking up the fat to make it easier to take out. So whether it's through mechanical vibration or through ultrasound or through laser, you're somehow breaking up the fat to make it easier to take out. I think with the laser, there is some component of skin tightening, so it's good for those patients that may need a little bit of extra help. Their skin isn't quite as elastic and won't have the same tightening effect.
Right.
The laser gives a little bit of an extra benefit there as well.
I think so. I think ultrasound, I've never really seen tightening. I used the Vaser a lot as a resident.
I have the Vaser.
Big. We used it a ton, and it was great. But I just didn't see the skin tightening I was kind of hoping for. And with mechanical, you definitely don't see it.
I like the Vaser for areas that are tough. So for gynecomastia. So if you're liposuctioning the breast tissue, which is very fibrotic and kind of tough, or if you're in an area which has been liposuctioned or has scar tissue from previous surgeries and it's just a tough kind of scarred up area, I do like the Vaser for that. It really does a nice job of breaking up that fat and that scar tissue to allow you to really do a good liposuction.
Yeah, no, I think for gynecomastia,
yeah, no, it's really great.
The Vaser is actually excellent for that. Power-assisted lipo is great for big jobs.
I do like the power assisted. I can tell a difference between when I have it and when I don't.
Yeah, I mean, if you don't want to be exhausted and getting recovery IVs afterwards, power assisted is the way to go. And so then after you do the liposuction, we close up all the holes and then we put people in compression garments.
And that's for the swelling because, number one, we just put a ton of fluid in you. And so that fluid is going to leak out and it's going to be a little bit oozy for a day or two.
I say put plastic bags on the bed or on the sofa and some towels, and you're going to need to wash them.
You're going to leak for a day. But then, yes, you're going to be swollen because it's traumatic. You're basically taking a very small bat or blunt instrument to your body multiple times. It is a traumatic thing, so you're going to swell. That's what your body's response is.
Putting a metal rod under the skin and moving it all over the place is traumatic?
Just a little bit. Just a little bit.
Yeah, it is. It's real surgery.
No, absolutely. And so, yes, you'll be in a compression garment. And I usually, depending on how much we've done and where it is, I say at least 3 weeks, ideally 6 with this compression garment, just to really make sure you get all that swelling out to the best degree possible.
I'm not like a crazy fan of compression garments, though I know I need to use them. I find that they can cause problems too. They can cause dents. Yeah. You have to pay attention. I mean, these operations are not for people that just kind of want to just have somebody do me, get this done. You have to be an active participant in your success.
I agree. And the other thing that can happen afterwards, so you've had your surgery, you're in a compression, you're waiting for your swelling to go down. The things that you can expect, you're going to be bruised. Not horribly, but there will be some bruising. There's going to be the swelling. It's painful. It's like someone took a small bat to you multiple times. You're going to
keep saying that, aren't you? You just want me not to sign up for this. You're going to keep saying that you're going to take a bat. Why don't you just get a Louisville Slugger right now? I'll just sit here and take it.
Do not tempt me.
All right. Well, I see where this is going. All right. So no lipo for me. Done.
But you're going to be sore. It can be a smaller procedure, but that's not to negate that you're going to have some discomfort afterwards. But depending on your pain control, you can be up and at 'em, within a couple days, back to work, walking around. And then you wait for the results. There are a couple things, though, that as a patient you can do to help your recovery and to get better and to a better shape quicker. I think compression is one, and I think lymphatic massage is another one. I really do think that's a good component.
Yeah, I mean, I like the lymphatic massage also. I think that you need somebody who's skilled.
Yes.
Who can, is competent.
Right. It's basically you're just massaging those areas of liposuction to get the swelling out and to sort of start smoothing it out and getting any little remaining lumps and bumps smoothed out.
Well, I think those are the big ticket items when it comes to liposuction. We'll get into all the